I'm Blair Erb, chairman of the PINNACLE Network work group of the American College of Cardiology. Central to our ability to provide high-value care to our patients is the acquisition of outpatient data through the PINNACLE Registry. One of the ways the PINNACLE Network provides tools to support practices during this transition is through shared experiences with mentors like the one joining me today. To that end, I'm happy to have G. Tucker with us. G is a member of our work group and has recently begun participating in the PINNACLE Registry. G is a solo practitioner in West Virginia. G, you're by yourself. You're on call all the time. You have the business to run. You have your patients to take care of. What were you thinking when you added to your workload by joining the PINNACLE Registry?
Oh, thanks, Dr. Erb. That's an important question. Like every fellow physician that I know of wants a compass, want to compare where he stands or she stands, how they are doing professionally. And additionally, with my experience in NCDR, which is cath lab and hospital-based registry, I saw the positive influence that has on our practice. So I was looking for some sort of tool that I can do in my office practice. And right along that, PINNACLE Registry came on. And it was no problem to decide, just pick it up and run with it.
So you made the decision that you needed to measure the provision of care to your outpatients. Did you have an EHR active in your practice? And if so, was it simple to use the registry with your existing EHR?
That's an important question too. You know, just about 15 years ago, I found out that there is just information overload. There's no way I can document all these things in paper chart and have it in front of my eyes. So I adopted EMR nearly 15 years ago, and I have grown with it. The EMR I have does not integrate with PINNACLE Registry readily, but there is a tool, and that helped me out. And the tool is called System Integration Tool. ACC staff has done just excellent job developing this tool with a software company. And all it required was 2 or 3 conference calls, 45 minutes each, and we were on board.
Do you have your own IT person in your practice, or were you able to do this with your existing staff with the assistance of the ACC staff?
Both. I do have IT specialist, a network administrator. I'm a solo practitioner. However, I'm heavily invested in software and hardware. And it is a business decision one has to make, and the return is tremendous. So IT and my office staff, teamwork, and we made it happen.
Tell me about your office staff. Our practice lives are critically dependent on those around us. How did they react to being part of the registry?
Initial hesitation, that's about it. But if you prepare them and tell them what is involved here, what is the driving force, and then comes some carrots. Example is that in 2008, 2009, we were filling about 400 to 500 forms for PQRI. Now all that thing is eliminated. That is a tremendous savings in time, and my employees really understand that.
That's wonderful. So now you've been submitting data live for what, 4 or 5 months?
Yes, we've been submitting for 4 months. Every 3 months I get the data. I had about 3 batches of data. And it's interesting how I look forward to having those data now, because I love to look at it. It gives me the direction as to where I want to go from this point on. Where am I missing? Where am I doing good job? And that just makes day-to-day practice, interviewing patients, sitting down with them, asking appropriate questions, filling in the gaps and holes, and every interview with a patient now is rewarding, because you know you are doing something tangible when you document there and then take a next step.
So it sounds as if in this very short time it's already influencing your practice. We're about out of time, G. I want to thank you for being here with us and sharing your experience with beginning to participate in the PINNACLE Registry. I think what we need to do is we need to provide our members with access points so that they can know how to contact us if they're interested in participating.
Thank you, Dr. Erb. And the ACC staff is wonderful, and It takes just one call or email, and you always get a prompt response.
Thanks, Jay.